Dr. Rena Malik, a board-certified urologist and pelvic surgeon, along with Dr. Andrew Huberman, discussed extensively about urinary, pelvic, and sexual health on the Huberman Lab Podcast. Their discussion dove deep into the function and significance of the pelvic floor, an area that both males and females possess, underlining the necessity of understanding and taking care of this organ. The pelvic floor, which Dr. Malik compares to a bowl of muscles, is attached to bones and supports all your organs. It plays a crucial role in urination, defecation, sexual function, and even posture. Interestingly, many pelvic health issues arise from people having either an overly tight or overly relaxed pelvic floor rather than needing to strengthen it as is often assumed. This is a vital distinction as it affects the bladder and sexual function in both men and women. Pelvic floor dysfunction can result from the muscles being overstrained, causing them to contract and shorten, leading to a number of health problems. It might cause urinary symptoms like urgency, frequency, and occasionally leakage, or make it difficult to urinate completely. Overstraining can also lead to pain during sex, erections, ejaculation, cause constipation, and back pain. On the other hand, a weak pelvic floor can cause urinary incontinence or leakage, notable in women after childbirth or in people with neurologic disorders. Pelvic health assessment involves a medical examination. For women, this can be done through the vagina, allowing the physician to experience the tenseness or weakness of the pelvic muscles. For men, this is typically done through a rectal exam. A symptom like pelvic muscles constantly squeezing or pushing can be indicative of a coordination issue within the pelvis. Acknowledging the importance and impact of pelvic floor health, physicians often advise patients to visit a pelvic floor therapist. Like a gym trainer, they work with patients in a prolonged approach to normalize the function of the pelvic floor. This includes aligning bones and adjusting postures to avoid straining the pelvic muscles. In this section of the podcast, Dr. Rena Malik and Dr. Andrew Huberman further delve into the importance of pelvic floor health and its maintenance. Dr. Malik outlines how an overly tight or relaxed pelvic floor can contribute to different types of health issues in both men and women. Additionally, the duo discuss Kegels, exercises designed to strengthen the pelvic floor, which were first proposed by gynecologist Arnold Kegel. Dr. Malik explains that Kegels, if executed correctly, can help with urinary incontinence and pelvic organ prolapse. However, she warns that if overdone, they can result in a tense pelvic floor, leading to pelvic floor dysfunction. Like any other exercise, gradually increasing reps and performing the exercise in different positions, lying down, sitting, and standing, is recommended. Further, the discussion shifts to how incorrectly performed exercises may lead to decreased blood flow to the pelvic floor muscles, potentially causing health complications. For instance, individuals exercising with incorrect breathing techniques, they tend not to exhale during the effort, which can cause problems. Moreover, Dr. Malik explains how nerves and arteries, especially the pudendal nerve and artery that run through the pelvic floor, can get inflamed, causing pain. They also talk about symptoms like low lubrication, pain during intercourse, loss of erectile strength, or erectile dysfunction, which could be blood flow related, hormone related, or neural related. While diagnosing these issues, the arousal and desire one has during sexual activity should be considered. For example, difficulty getting erections can be caused by stress, anticipation about one's performance, or vascular issues. Lastly, they discuss how hormones, especially testosterone, predominantly modulate desire in both men and women. While testosterone is associated with erectile function, it is more related to desire rather than erections. Just 3% of erectile dysfunctions are related to hormones. It's important to understand that these issues could be because of hormonal dysfunctions, nerve issues, or blood flow insufficiencies, and must be identified appropriately for correct treatment. Dr. Rena Malik and Dr. Andrew Huberman continue their comprehensive discussion on pelvic floor health, this time focusing significantly on addressing how to recognize and combat issues related to sexual dysfunction. Dr. Malik explains that Kegels exercises intended for strengthening the pelvic floor can bring about benefits such as alleviating urinary incontinence and pelvic organ prolapse. However, if performed in excess or improperly, they can lead to a hypertense pelvic floor, resulting in pelvic floor dysfunction. Therefore, building up the frequency gradually and performing them in various positions is advised. In addition, they shed light on the potential risks associated with improper exercise, which might decrease blood flow to the pelvic floor muscles and invite health complications. Dr. Malik emphasizes that breathing techniques during exercise plays a crucial role, and mistakes in breathing practices can also cause issues. Delving deeper into the topic of sexual health, they discuss the role the pelvic floor plays in sexual satisfaction and functionality. Symptoms such as low lubrication, pain during intercourse, a lack of erectile strength, or erectile dysfunction could all potentially be related to pelvic floor health and can result from blood flow issues, hormonal imbalances, or nerve-related problems. While many might associate difficulty with maintaining an erection purely with physical issues, Dr. Malik and Dr. Huberman highlight the complex nature of arousal and how problems might not be purely physical. Stress, anxieties concerning performance, or even vascular issues could all contribute to sexual dysfunction. The crucial role hormones, especially testosterone, play in sexual health is brought to the forefront. While testosterone is associated with erectile function, it's more closely linked to desire rather than erections themselves. Notably, just 3% of erectile dysfunctions are related to hormones. Therefore, a correct and careful identification of issues regarding hormonal dysfunctions, nerve problems, or blood flow insufficiencies is important to curating appropriate treatment. Additionally, according to Dr. Malik, older people could have less responsiveness due to aging nerves and their receptors becoming less sensitive. Outside factors like relationship dynamics and life stressors, too, can impact the arousal response. Through their discussion, they underline the importance of specialist intervention like those from urologists, gynecologists, or even a physical medicine and rehabilitation doctor that specializes in pelvic floor health. It is highlighted that not all pelvic floor physical therapists treat all genders. Thus, it is important to find a therapist that has experience with one specific gender. The dialogue also deepens into the effects of hormones on sexual health. Dr. Huberman cites common misconceptions such as the belief that estrogen is anti-male, which are misleading. On the contrary, estrogen is beneficial for brain function and libido in both men and women. Furthermore, Dr. Malik adds that only around 3 to 6% of erectile dysfunction is hormone-related, contradicting common beliefs mishandling testosterone as the main proponent of libido. The talk winds up with topics on nitric oxide, the ignition behind erections, along with a discussion of different medications that aid erectile dysfunction and their function mechanism. Citrulline and arginine, common supplements in the market, are highlighted and how they function by boosting nitric oxide availability, hence aiding erection longevity. However, the mainstream hesitation among medical professionals to recommend supplements due to the lack of reliable regulation in the supplement industry is also addressed. In their discussion, Dr. Malik and Dr. Huberman delve into how various treatments and lifestyle habits affect erectile dysfunction. Dr. Malik reveals that approximately 60 to 70% of men experiencing erectile dysfunction obtain relief from medications like Cialis or Viagra, which are aimed at facilitating blood flow to the penis. However, they caution that the inability to maintain an erection can also be psychogenic, where worries about sexual performance hamper erectile function. Dr. Malik suggests that, in the younger generation particularly, the increasing prevalence of pelvic floor dysfunction may be to blame, a condition often aggravated by high stress levels and prolonged sitting. Interestingly, a significant portion of questions Dr. Malik receives on the topic originate from men in their 20s and 30s, contradicting the common perception that erectile dysfunction is an issue primarily affecting older men. This shift, according to her, may be due to changes in the modern lifestyle, which can cause physical strain and mental stress, potentially leading to pelvic floor dysfunction. Other factors, such as a mutual feedback loop of anxiety and sexual dysfunction, can also exacerbate the problem. The effect of pornography on sexual health was another critical subject examined in the discussion. While porn use is not problematic for everyone, Dr. Malik warns that pornography could potentially cause issues for some individuals. Benefited by easy access to explicit content, some men, particularly the younger generation, might not be able to differentiate between the exaggerated sexual experiences portrayed in pornography and what sex is like in real life. In addition, they could develop a dependency on visually stimulating material for arousal, which might then inhibit arousal in normal circumstances. However, The segment stresses the importance of reducing any shame associated with the use of pornography, clarifying that it's problematic only when it leads to an avoidance of real-life obligations and relationships. The conversation also briefly touched on the use of low-dose Cialis for prostate health and introduced the growing trend of combined low-dose Cialis and apomorphine usage. They also explored how females could potentially benefit from low-dosage daily Cialis if they have vascular issues contributing to sexual dysfunction. Dr. Malik suggests adopting habits like using a standing desk and walking more to counteract the impact of prolonged sitting, both for improving pelvic floor function and overall health. She encourages open conversations about sex to dispel misconceptions and promote healthy sexual relationships. Dr. Malik and Dr. Huberman delve deeper into the female sexual response and some common misconceptions about it. The stereotypical idea that women need more foreplay or are more relationship-based in their sexual response can be misleading, as women's sexual desires can vary vastly. The discussion moved towards the female arousal response and orgasm, breaking them down into phases. Using research from Masters and Johnson, Dr. Malik explained that the first phase of female sexual arousal is excitement. This stimulates an increase in heart rate, heavier breathing, and signs of redness in the vulva and nipples, accompanied by vaginal lubrication. The excitement phase leads to the plateau response, where the initial excitement peaks and maintains a steady flow till the orgasm phase commences. The orgasm phase involves rhythmic pelvic floor muscle contractions until reaching the recovery period, a time where the body recovers and cannot orgasm again for a short period. Dr. Malik introduced FDA-approved medications, bremelanotide, Vilisi, and flibanserin Adi, for women with hypoactive sexual desire disorder, or low libido. These medications, which have a success rate ranging from 45 to 60%, work by adjusting brain pathways to increase desire. Though effective, they are brand-name drugs, so they tend to be expensive and insurance may not cover them. The conversation also discussed female physiological changes during sexual arousal, highlighting how the cervix moves and the vagina elongates to allow penetration. The rate at which these adaptations occur varies from person to person, which necessitates adequate arousal time to prevent painful intercourse. Importantly, the discussion emphasized that measuring libido is subjective and depends on one's personal desires and expectations. No distinct standards define high, medium, or low libido. It comes down to what works or doesn't work for you in the context of your life. The key is to identify any disparities and work towards achieving a harmonious sexual relationship for both partners. The discussion continued between Dr. Huberman and Dr. Malik on the podcast, highlighting some misconceptions about female sexual responses. Dr. Malik addressed the topic of pheromones and how they play a role in sexual attraction. She pointed out that the natural scent of an individual can be a potent factor in generating arousal in their partners. The conversation then veered towards concepts of cleanliness and hygiene that are propagated towards women. Dr. Malik clarified that the idea that women should smell a certain way as a result of aggressive marketing strategies can negatively impact a woman's natural flora, microbiomes, and the perception of standard cleanliness. She noted that often women end up damaging their natural pH balance by using products that may cause adverse effects such as UTIs or bacterial vaginosis. Bringing focus back to the process of sexual arousal and orgasm, the conversation touched upon the subject of female orgasms and female libido. Dr. Malik added that orgasms in women can vary greatly in terms of intensity and stimuli, noting that orgasms can be triggered through varied means such as visual, auditory, or simply nipple stimulation. Different areas like clitoris, cervix, and even areas around the vagina can be stimulated to achieve orgasm. She pointed out that 85% of women require clitoral stimulation to climax, and only a small percentage climax purely through vaginal penetration. Dr. Huberman brought up the role of dopamine in the arousal arc, shedding light on its association with not just desire, but also the ability to achieve physical arousal. He pointed out how some drugs can potentially interfere with this cycle, sometimes leading to an increase in desire, but not being able to achieve physical arousal. Dr. Malik concurred, stating that while, in theory, drugs that stimulate dopamine release like apomorphine could increase desire, their effects may vary significantly between individuals. Throughout the conversation, the key takeaway remained the importance of clear communication between partners about their likes, dislikes, and preferences, emphasizing that mutual understanding and responsiveness are vital in achieving a satisfying sexual relationship. The session then delved into complex issues around urinary tract infections, UTIs, a common health concern predominantly for women. Dr. Malik emphasized the importance of staying hydrated and fully emptying the bladder during urination. In cases of recurrent UTIs, which typically means 2 or more within 6 months or 3 or more within a year, vaginal estrogen was cited as a highly effective treatment. This treatment is deemed safe with no reported cases linking it to cancer or other adverse events. Dr. Malik mentioned that postmenopausal women, those who've undergone surgical menopause, or those suffering from estrogen deficiency post-childbirth could highly benefit from vaginal estrogen use. She went on to reveal that for men, UTIs are significantly less common due to the length of the urethra, meaning that when a man is reported to have a UTI, it must be investigated thoroughly. If individuals suspect that they aren't fully emptying their bladder, sitting during urination was suggested to help. Dr. Malik pointed out the beneficial role of cranberry supplements in preventing recurring UTIs. The active ingredient in cranberries, called proanthocyanidins, or PACs, should be the main focus. But not all supplements on the market will give the needed benefits. The packs need to be in a soluble form. These supplements appear to be particularly effective at reducing the risk of UTIs when taken 2 days before and after sex. Spermicides were discussed as a known risk factor for UTIs. Dr. Malik made it clear that if a condom has spermicide, or if one uses spermicides, there is a clear connection to a higher rate of UTIs. These preventative strategies form the basis of dealing with recurrent UTIs effectively. Clear communication, understanding, and knowledge about one's body play a vital role in maintaining sexual and urinary health. Dr. Malik delved into prevention methods for UTIs. D-mannose, a simple sugar found in many fruits, can be taken daily to potentially reduce UTI risk. It acts as a type of decoy, attracting bacteria away from the urinary tract lining. While it has shown promising results in small randomized controlled trials, more research is needed to confirm its efficacy. The role of the microbiome in sustaining urinary health was also highlighted. Dr. Malik mentioned ongoing studies at UCLA focusing on the urinary microbiome and its potential role in the occurrence of UTIs or overactive bladder. The idea is to find out if our microbiome contains certain factors that can be targeted for treatment or prevention of UTIs. Dr. Malik addressed the topic of recurrent UTIs making patients feel dirty. She assured that it's most likely related to a microbiome effect or a hormonal effect, not a personal hygiene issue. Overcleaning can, in fact, disrupt the healthy microbiome balance and could potentially increase the risk of UTIs. A common condition closely associated with frequent UTIs is pelvic floor dysfunction. This can start with a UTI triggering the pelvic floor to tense up, which then doesn't relax, causing further discomfort and creating an unfortunate cycle. Regarding contraceptives, particularly oral contraception, there's a marked influence on sex hormone-binding globulin, SHBG, which binds to testosterone, potentially leading to a decrease in libido. There's a subset of women for which oral contraception can have severe consequences, increasing SHBG and thereby reducing the bioavailability of testosterone, an essential hormone for desire. Dr. Malik stressed the importance of understanding these effects. However, many agree that oral contraceptives have revolutionary implications for sexual freedom and preventing unwanted pregnancies. Segmented studies even indicate prolonged elevated SHBG levels after discontinuation of oral contraceptives. However, it's still uncertain whether these effects are permanent. Moreover, some speculate that oral contraception could potentially disrupt neurotransmitters, contributing to depressive-like symptoms, although no conclusive evidence supports this theory. The response to oral contraceptives varies significantly among individuals, and further research is necessary to demystify these effects fully. Dr. Malik's comprehensive discussion on various aspects of sexual and urinary health in both men and women provides fascinating insights into the finer mechanisms of our body's function, along with dispelling certain misconceptions about commonly debated topics like safe sex, contraceptives, and lifestyle choices. Addressing the topic of long-acting contraceptive methods like an IUD, Dr. Malik emphasized their safety and effectiveness. While each IUD insertion involves inherent risks, it remains a reliable contraceptive method when properly inserted. Contrary to common belief, the copper used in IUDs acts as a deterrent for sperms, making the copper IUD a reliable contraceptive choice. Despite the potential benefits of oral contraceptives, antidepressants, especially selective serotonin reuptake inhibitors, SSRIs, have often disrupted patients' sexual functions. This, however, isn't universal and often depends on the individual's unique biological mechanisms and reactions. In some cases, reducing the dose of SSRIs or bringing in erectile dysfunction drugs such as Viagra or Cialis can help counteract this issue. It's important to understand the interrelation between depression and erectile dysfunction when treating patients. Healthy prostate function and regular exercise-related issues also came into the discussion. Cycling, for example, may cause numbness and reduced arousal due to increased pressure on the perineum. Selecting the right saddle, maintaining proper posture and balance can help mitigate such risks. Getting into less discussed territories, Dr. Malik highlighted the importance of safe anal sex practices, decrying assumptions around safe sex and emphasizing the higher STI risk due to the sensitivity of the anal tissues. She advised the use of contraceptives, adequate lubrication, and patience to avoid trauma. To conclude, much of our sexual and urinary health depends on our lifestyle, mood, physical activity, and our social and emotional environments. Understanding these aspects can help us make better and informed choices. This summary captures some of the key points discussed by Dr. Andrew Huberman with Dr. Rena Malik. This segment offers insight into some of the lesser-known aspects of sexual and reproductive health and preventive care. As we deepen our understanding of these topics, it opens up more conversations to be had, offering a wealth of insights for both the medical community and the greater public. The podcast smoothly transitions into a robust dialogue about natural supplements and their effects on sexual desire and function. Beginning with a focus on behavioral tools first is Dr. Huberman's mantra, as these lay the groundwork for mental health, physical health, and performance. Collaboratively, they reflect on how prescription drugs sometimes serve as necessary aids when mental states or depression prevent people from avoiding harmful habits or engaging in beneficial ones. The conversation moves to natural supplements, tonga ali, maca root, and shilajit. Tonga ali, primarily Indonesian or Malaysian, is seen as an effective mild libido enhancement, especially for people taking SSRIs. Maca root, with its potential estrogen receptor modulation and possible dopaminergic tone changes, is also examined. However, shilajit is less explored, and defining its quality and dosing still remains a challenge, signaling a need for more comprehensive studies. Dr. Malik reemphasizes the importance of behavioral management in her patient population, propounding crucial lifestyle changes such as managing high blood pressure, diabetes, exercising, and achieving good sleep. Interestingly, she notes how quickly men change their behaviors when they're preparing for surgery for erectile dysfunction, stressing out how physical health directly correlates to sexual health. Supplements like L-citrulline and ashwagandha for stress reduction have scientific backing and are considered reasonable choices. They encourage people to be patient with the results of these supplements, as building over time is more likely than an immediate surge. Dr. Malik advises trying one supplement at a time to gauge the efficacy. Both Dr. Huberman and Dr. Malik strongly emphasize working on the conventional lifestyle factors before turning to supplements, as improving diet, exercising, and getting good sleep boosts testosterone and has many other benefits. One interesting point raised is about true organic impotence, where a biological problem leads to sexual dysfunction. In such cases, it's vital to assess cardiovascular health, since erectile dysfunction can function as a forewarning for potential cardiovascular problems. They strongly encourage people not smoking, as it can severely harm the erection. Dr. Malik's expertise offers a thoughtful, logical, clear, and respectful approach to topics that many people shy away from, admits Dr. Huberman. She has illuminated how to promote the health of the sexual system, an incredibly crucial aspect of human life. Her work is respected and appreciated. The host concludes by providing information about strategies to support the podcast, including subscribing on YouTube, Spotify, Apple, and leaving 5-star reviews, and checking out the sponsors' offerings. Dr. Huberman mentions partner momentous supplements and mentions the opportunity to receive a 20% discount. The podcast also emphasizes the worth of the Neural Network newsletter, a free resource providing summaries of the podcast's episodes, protocols, and short PDFs regarding topics such as sleep, neuroplasticity, and fitness. Check out the full podcast by clicking the link in the description below. Make sure to like, comment, and subscribe for more content like this. Thank you for listening to this podcast summary episode of the Pod Slice